Hey guys, welcome back to my channel, The ENT Resident. Today I'll be discussing about a very short topic, something that is a part of anatomy of pharynx. These are structures called as vallecula. Now, what are vallecula? Vallecula are these small cup-shaped depressions which lie between the base of tongue and the anterior surface of the epiglottis. If you see in the picture over here, this is the base of tongue and this is the epiglottis. The region that you see that lies between them is the vallecula. So this is the vallecular region. Now, next we have to know what are the boundaries of vallecula. Now, the vallecula has a medial boundary by the median glossoepiglottic fold. You see the fold over here, which goes from the anterior surface. It's a fold of mucous membrane, which is reflected from the anterior surface of epiglottis to the base of the tongue. This is the median glossoepiglottic fold. And lateral boundary is formed by the pharyngoepiglottic fold. Pharyngoepiglottic fold is basically the lateral glossoepiglottic fold which extends from the lateral aspect of epiglottis to the pharyngeal wall. You can see over here, this is the pharyngoepiglottic fold on both the sides, which is extending from the lateral surface of epiglottis to the pharyngeal wall over here. So this is forming the lateral boundary. And as a result of this, you see over here that these two cup-shaped depressions that you see over here, these are the vallecula. Now, the pharyngoepiglottic fold is important in surgeries because in transoral surgeries, this area is very important because this pharyngoepiglottic fold has the neurovascular bundle inside of it passing through. Now, this neurovascular bundle includes the superior laryngeal artery, superior laryngeal vein, and internal branch of superior laryngeal nerve. Because it is passing these neurovascular bundle, this is a very important landmark that is important in transoral surgeries in cases of larynx and hypopharynx carcinomas. So this is about the boundaries of vallecula. Now let's talk about what is the nerve supply of vallecula. The nerve supply of vallecula comes from two parts. The first one is the glossopharyngeal nerve or the ninth cranial nerve, which supplies most of the vallecula. And a very small portion, an anterior part of the vallecula, is supplied by the internal laryngeal nerve. Now, this internal laryngeal nerve is a branch of superior laryngeal nerve, which in turn is a branch of the vagus nerve, which is the 10th cranial nerve. So it's getting its sensations from the 9th and the 10th cranial nerve. Now, the last part of it, we need to know what is the applied importance of this vallecula. First of all, as I just said, the nerve sensations are by the 9th and the 10th cranial nerve. So this becomes important in the gag reflex. Now, and what is gag reflex? Gag reflex has this afferent and efferent pathway. So the afferent pathway involves the glossopharyngeal nerve. So whenever you touch anywhere in the vallecula, the posterior part of the tongue and the oropharynx, this is the afferent limb. The glossopharyngeal nerve is the afferent limb of the gag reflex. And the efferent limb is by the vagus nerve, which is the 10th cranial nerve, via its pharyngeal branches. So, when you test the gag reflex, basically it helps you in assessing the integrity of these two cranial nerves. And if a vallecula is touched during intubation or endoscopy and the patient gags, this pathway is intact. That's what is important over here. This when the patient ends up gagging, it tells you that okay, that this pathway of gag reflex by the 9th and the 10th cranial nerve is intact. That's the first point. Next, move on to the second one. Second one is in airway anesthesia and awake intubation. Now we know that the internal laryngeal nerve supplies sensation to the anterior part of vallecula, the lingual surface of epiglottis, and the larynx above the vocal folds. So during awake fiber optic intubation, this internal laryngeal nerve is blocked via the thyrohyoid membrane to suppress this gag reflex that I was just talking about. So it suppresses the gagging and the coughing by anesthetizing the vallecula and the supraglottic larynx. This is the second applied importance of vallecula. Next, This is also the vallecula being cup-shaped depressions, and because of its location, it is also a very common site of foreign body lodgement. For example, like maybe a fish bone getting stuck in the throat and the patient complaining of this foreign body sensation in the throat. Because of this rich sensory innervation, lodgement here can be very, very uncomfortable, and this can trigger gagging, coughing, and choking. And lastly, this area is also a most common, not most common, but a very common site for development of mucus retention cysts. And when there is a lesion which involves this area, which can be a vallecular cyst or squamous cell carcinoma, patient usually present to you with foreign body sensation, pain during swallowing or odynophagia, and changes in the voice if the internal laryngeal nerve gets involved. Laryngoscopy, direct laryngoscopy or indirect laryngoscopy can help in visualizing this. So, this is all about the vallecula. If you have any more questions about vallecula, you can comment it and I'll get back to you. Thank you.